Thank you for joining our presentation, where I'm going to be talking about data insights during COVID-19. I'm Kate, a clinical psychologist working at Vitalk here in Brazil. I wanted to begin just by setting the scene. So here in Brazil, we have the highest anxiety prevalence rate in the world and the 5th highest for depression. Yet only a tiny proportion of those people actually get any mental health treatment. And the reasons for that include a lack of resource, high stigma, and low mental health awareness and literacy. But thinking about digital health, Brazil has a relatively high internet penetration, and actually most of these people access the internet via mobile phone. Even if they don't have a chip or SIM card, they'll go to a local cafe and log on to the Wi-Fi there. So we think this gives a great opportunity to use digital technology to address the mental health treatment gap. And from this realisation, Vitalk was born. And this is Vicky, our virtual mental health assistant. So Vitalk is a smartphone app, and we have 3 main components: a mental health checkup, self-help strategies, and the opportunity to talk with a psychologist. The mental health checkup uses validated scales to assess depression, anxiety, and stress. For health workers, we also measure resilience and burnout. All of the questionnaires are delivered in conversation format by Vicky within the app. And after the user completes them, they get personalised feedback on their scores to help them understand what that might mean for them. Where relevant, organisations can also get aggregated data insights. So for example, if we implement this in a hospital, they can find out particular roles or maybe departments that have higher rates of burnout. And this can enable the organisation to target interventions appropriately in those areas. So following the checkup, we've got the self-help strategies, and we have some specific programs depending on the user's goals. So the key programs are low mood, anxiety, stress, relationships, and more recently COVID-19. We've also got some on-demand conversations, for example, dealing with conflict or alcohol misuse, that users can access as and when they need, and some audio sessions, which include things like relaxation and breathing exercises. All of the content is written by clinical experts, so that is psychologists and nurses, and an excellent user experience team who bring it all to life for us. All of the tools are evidence-based, primarily CBT, but also some positive psychology in there too. And our initial studies have found that 1 month of engaging with Vitalk can lead to symptoms of anxiety, low mood and stress, all reducing by 30%. And the excellent thing is that all of these self-help strategies and programs are completely free. So the third component is Vitalk Personnel. This is where the user can talk with a psychologist. Here, a more detailed assessment is completed, and the psychologist completes a personalised care plan with the user. All communication is via asynchronous chat within the app. The psychologist can signpost or refer on where appropriate. So for example, if we have any risk issues or we think a different approach might be more beneficial to the user. We've also recently integrated this with a chatbot, so we've automated some of the exercises which enable the user to get more out of their time with the psychologist. Because this is the paid for part of the app, it enables to keep the costs lower, so it's accessible to more people here in Brazil, which is really important and something at the heart of our values. So in terms of who uses Vitalk, typically it's females 18 to 24 living in urban areas. Most people find us through social media, mostly Instagram, because that's very popular here in Brazil. And when looking at the symptom profile, most people tend to score in the clinical range. So you can see over half actually here in moderate and severe ranges. It suggests that our users have high-level baseline symptoms, which fits with the Brazilian prevalence rates I explained before. But we do need to be a little bit cautious, and here we need a validation study to check the effect of using a chatbot plus gamification on the psychometric properties of the questionnaires that we use, and this is something we hope to do later in the year, because as far as we know hasn't been done yet. So now you know a little bit more about Vitalk, let's move on to thinking about COVID-19, and I just wanted to put the data in context. As you know, COVID-19 started in China. It then came to Europe and later to Brazil. So we had our first case in February, first death in March, and obviously cases continue to increase. So it's important to just hold this in mind when I'm talking through the data in terms of if we compare to other countries for the psychological impact. The other thing that we really need to keep in mind is the size and diversity of Brazil. So it's huge, 212 million people. And actually you could fit the whole of Europe into the landmass of Brazil. There are 26 states, each of whom has their own response to COVID and different prevalence rates at different times. So although it started in Sao Paulo in the south, by June there was more cases in the northern states. So again, when we're analysing the data, it's not just one size fits all. So in terms of our insights, so when analysing the data by month, at first we didn't really see much change, but by June and July, our download rates had increased fourfold. And we don't know if this is due to COVID or perhaps mental health awareness, but it could also be marketing campaigns that happened around that time. So we're going to continue monitoring it, but just cautioning over-interpreting that result. In terms of content, over the months we've seen less active engagement with the COVID topics. And we've asked users about this, and they said that actually they're just really sick of talking about it. So although they're still selecting topics on anxiety or low mood, it's things that don't fall under the banner or headline of COVID. We've also found an increased demand for the asynchronous chat with the psychologist. And again, when we've asked users about this, they've said that previously they might have used teletherapy, but now they don't have the privacy because they're in quite close quarters with family and people that they lived with. So actually text is a really good communication tool for them because it allows more privacy. And the topics that people are talking about, again, this won't come as any surprise, loss of loved ones, anxiety about becoming sick, and also various different uncertainties. So here we analyse baseline symptoms for our general user population. So that's symptoms people report when they download the app and complete the first checkup. Unfortunately, because we only launched this time last year, we haven't got any data from the previous year to compare it to. So we've only looked at data month by month, so we've got December to July. Overall, the sample, as you can see here, score in the moderate range for anxiety, but many report severe symptoms. This didn't really change month by month, but we saw slightly more people reaching caseness in March and again in July, but this wasn't significant. We also compared the first quarter to the last quarter, but again there wasn't much difference. Perhaps some of that is due to anxiety being very high to begin with. We could hypothesise some of the variations are due to things like the unknowns when COVID-19 first arrived, the uncertainty about when it'll end, and the impacts on job or the economy. But it can also be lots of variables outside this. So we have, obviously, in December we have Christmas, February we have Carnival, which is a huge holiday here in Brazil. So we think any conclusions, given the small variation, is a bit of too much of a leap from this data at the moment. But we will keep monitoring it. When we looked at depression, overall the sample scored in the moderately severe range, again with large numbers reporting severe symptoms. We saw more variation over the months for depression than for anxiety, and in terms of the mean scores, our lowest was in April and highest in December. When we compared the first and the last quarter, the mean was actually slightly lower in the more recent times, which was quite interesting, suggesting less severe symptoms, or at least in those coming through to the app. But again, lots of confounding variables in terms of Christmas and Carnival and other life events. Most interesting, we thought, is the drop in numbers in the clinical range in April and May. And we hypothesised this could be due to a sense of sort of being in it together, so no longer facing our problems alone, but in fact the whole world is going through something, a very shared experience, although everyone's situation is obviously different. There could also be less stress faced by some of people staying at home, so perhaps if there were triggers for their low mood, staying at home might have eliminated some of those. But I think also important to remember that for some people, staying at home is actually more stressful as well. So it's a very individual thing. The change in June could also be related to an increase in unemployment. So we found quite a significant shift between May and June. Unemployment here in Brazil increased by 16%, and that could potentially be a big factor here for mood. But it could also be that the app is attracting different people. So perhaps as mental health awareness is more normalised, more people are talking about it, people with milder problems might actually start to seek help more. Again, just another hypothesis. Then we wanted to look at health workers, so it's a different data set to the one I've just presented. And this is because we've got a specific product for health workers, so that's doctors, nurses, allied health professionals, etc. And we've tailored content to make it more relevant to them. And the launch for that product was actually planned to be March, and it was complete coincidence that it coincided with COVID-19, but quite a great opportunity. So this means the data we have here is only from April. And we found the sample to be in the moderate range, the same as the general user population over the same time period. In terms of the change over time, we saw a slight increase of people at caseness coming through in later months, but again anxiety levels were very high throughout, just reflecting the high prevalence typically found in Brazil, and not too much variation by month. So I think here, whilst a lot of people predict health workers experience more anxiety in this situation, rightly so given the risk they face on the front line, it's also worth considering that many will have experienced previous outbreaks of infectious diseases here in Brazil and a lot of crisis and risk management. And they're also generally not facing it alone, and so have some buffering effect of the health system around them. But we think this is definitely something to monitor, particularly given the high rates of anxiety. And perhaps later we might want to do some assessment for specific anxiety disorders. When we looked at depression in the same sample, it was quite interesting. Overall, the symptoms for health workers were in the moderate range, but the general population over the same time period were in the moderately severe range. And actually for some months, there was almost a third more clinical cases in the general population of users coming into the app than the health workers. There might be something here about health workers being in work, so unemployment not being a risk factor, having a sense of purpose, camaraderie, maybe connection with others. And that could also explain the lower rates we saw in May and June when we saw more of this. And we wondered if time goes on, if we'll see more impact of people not having the time or the energy for all of those extra activities, self-care, replenishing activities that we know are important for mood. So again, it's useful to monitor this and keep it in mind and use this data to target interventions appropriately. In terms of limitations and challenges, I think the biggest is in relation to the disparity we see in users across Brazil. So for instance, in Sao Paulo alone, we have the GDP per capita and life expectancy of Norway, one of the highest in the world, and Sierra Leone, one of the lowest. And in Latin America, 2 in 5 people can't afford to socially distance during the pandemic because they depend on informal cash work week to week to feed their family. There's also many people living in overcrowded conditions. So this is likely to have an impact on people's experience of COVID-19 and therefore the mental health impact it will have. So this makes it really hard to draw any conclusions about Brazil as a whole, and we need to take a more individualised approach. As I've said, we've got lots of confounding variables, such as time of year, or internally things like marketing campaigns, which we need to hold in mind. And whilst we aim to reach all of Brazilians, our data is limited, obviously, to those who have internet access, and also those who are motivated to seek treatment or tools to manage their mental health. So this represents our users and not Brazil as a whole. In terms of moving forward, first we're going to do more analysis on the resilience and burnout data and the issue of diversity I just mentioned. And we also want to continue to monitor symptoms over time for new and existing users. And we'll be evaluating the impact of using Vitalk programs on the symptoms too. In terms of what we see, we think there's going to be an increase in mental health awareness and a breaking down of stigma. It's being talked about more openly and helping to normalise the experience, certainly here more than it ever has before, which is a really positive development. We also think there's going to be an increase in text-based and online interventions as people are becoming more open to this idea and can see the benefits. In terms of the impact of COVID-19 on mental health, it's easy to presume we're going to see more anxiety, more depression and more PTSD. We haven't seen such significant levels yet, but obviously we will keep monitoring it. But we also need to consider issues of post-traumatic growth and resilience too, and individual circumstance. So in conclusion, this high-level data is helpful and we think it will serve as an initial guide, but we believe really it asks more questions than it answers, so it truly is only the beginning. And that brings us to the end of the presentation. Thank you so much for listening. Obrigada. Any questions, please reach out anytime.